right, so today we are going to talk about chapter 5. We're going to start that. Hey, it worked. Let's go. Already off to a good start. So, chapter 5 is all about evidence-based practice, research, and professional literature. Okay. So, when I say evidence-based practice, what does that mean to you guys? What pops into your head if I say that something is an evidence-based form of practice? It's supported, okay? Rose, what do you think? Okay. All right, Sydney, what do you think?
I didn't hear what the other two said, but I think it's something that has had multiple like trials or has gone through different stages
Okay.
to get where it's at.
Okay. So do you think that that is something that is important when we talk about occupational therapy, like interventions, things that we're doing with patients? Is evidence-based, exactly, right? Everything that we do has to have an evidence base behind it. Now, that doesn't necessarily mean that every intervention you're going to have or that you're ever going to come up with a patient is going to have this massive study behind it backing what you're doing, because we're unique individuals, right? We come up with things that, hey, this worked with this patient, I might try it again with another. And then you've actually kind of started your own type of research with that, right? Some things are more basic, like if somebody's arm is tight, they have spasticity in their arm or an old injury or whatever it is, and we move it. There's evidence behind that enough people have moved arms enough to show that that will help with their range of motion, right? So there's things that are extremely grounded with evidence. And then there are things that have a little bit of evidence with them, but it doesn't necessarily mean that they're wrong. But we're going to try to tell the difference between the two. Okay. All right. So making clinical decisions that are grounded in science. That's what we're going to define evidence-based practice as. Okay. That means there was some type of a research, there was some type of an experiment done in behind this practice in order to show that it works or doesn't work or whatever it is. Okay. um, you need to be able to explain what is being done and why. So, for example, if somebody comes up and they start putting electrodes on your arms to do e-stim, but they don't tell you why, would that not kind of freak you out? I mean, that's kind of invasive, right? So if somebody is not telling you, hey, this is actually going to help, with pain or whatever you're working on with it, it might freak you out a little bit. That's kind of why we need evidence based. Like, so this has been shown in such and such a study to help with such and such a disorder, right? So we need evidence behind it so we can explain it, not just to the patient, but also to colleagues. If you come up with a new treatment intervention and you want to share it with your colleagues, either you need to perform some type of a study, big, small, whatever it is, and back it up with data, back it up with research, and talk to one another with your colleagues to explain how this works, right? Um, this includes several different things. This includes clinical reasoning, which is basically just why are you, your personal reasoning, right? There's a clinical reason behind it. Your experiences, the client's values themselves, and the preferences. One thing that I need you guys to remember, that regardless of evidence-based practice, even throw it out the window if you want, every single individual that you guys will ever treat or ever be with is a unique person. We don't work on a one size fits all type of therapy, right? That's other types of therapy that we will not mention that are more straight line, black and white type minded. We're a very colorful, holistic type of therapy that really takes into account what the individual needs, what they value, what their experiences are, what their culture is. So just because we find something that is evidence-based does not necessarily mean that it will work for everyone. Okay. Um,
So basically, you can make adjustments. You could use that to make adjustments to fit that person's need.
depending on your intervention, yes. Yep. All right. So let's talk about the process of using research in practice. Okay. The very first thing that you have to do is very simply, you need to identify a problem and ask a question. Okay. Here's this person's issue. How am I going to fix it? Okay. It's as simple as that. Next is identifying the relevant evidence. So based on the problem, you need to find evidence around that it is an issue. It could be something as simple like this hurts. It's a personal thing. Or it could be there's an issue that is bigger than just the one person. In this community of people, we are seeing this type of disorder or whatever. It could be something like that. Okay. Next is evaluate the evidence. First off, not all studies are equal. Okay. Just because your second uncle, cousin twice removed said something on Facebook, that doesn't mean that it is equal to a national research produced by the American Occupational Therapy Association, right? Like those two opinions are not equal. So we're not really going to take the second uncle, cousin twice removed's opinion into our research. We're going to listen more to the people that know kind of what they're doing, right? I think that in the world that we're in with COVID right now, there's a lot of Facebook doctors and things that we run through, and people are more susceptible, and even people that you would never dream of that would believe some of the stuff that they see, some of these articles and things that they would see. You're like, what, is there any evidence for that? Like, what are you even talking about? And then it's like on this really random website that this absolutely mind-blowing information came from, but it's the only place that's covering the story. That's probably not true information, right? So it's the same when you're evaluating evidence. You have to decide what is actually accurate, what is relevant information, not just randomness. Okay. All right, next is implement the useful findings. If you find something in your evidence that is helpful or relevant, start it. Practice with it. See what happens, okay? And then you need to evaluate your outcome. You want to draw your own conclusion from when you implement something, right? So for example, if you wanted to, I mean, this is a very common one, but somebody has poor range of motion, you try to do some passive range of motion by moving their arm, and it doesn't help, right? It's still very tight. There's still a lot of pain when you're doing it. And then if they're indicated, you throw a little bit of heat pack on them for 20 minutes, and all of a sudden they have a little bit more range of motion and less pain. You're like, okay. So heat helps with pain and range of motion. Let me try it with this one. Okay, let me try it with this one. And after you have tried it multiple times and you keep getting these outcomes, you've started your own research or study, right? Cool. All right. Oh, I didn't talk about the last part. Sorry. All right. So understanding what you're looking at. First, you have the introduction, okay, to your research. That is just providing background information. Okay, that's just, hey, it's nothing more than a simple introduction. Next are the methods. This is you're talking about all the processes that you used, how you conducted it, kind of like it's a little deeper than an introduction into the research. It's, hey, this is what we did. You're explaining it a lot more. Okay. Then you have results. That's what happened, right? We did this. This is how we did it. Now we're at the part of this is what happened. And then the discussion is talking back and forth of finding things that more people that it might work for. Or a very important part of it is the limitations of it. So saying that, okay, but heat works for this person with their range of motion, right? And it works for so and so and so and so and so and so, but you wouldn't want to put it on somebody that has rheumatoid arthritis. We'll learn that later, but it doesn't work for people like this, right? That's a limitation to this intervention. So a lot of times you see these things with medicine, right? Like you have the commercial of the woman chasing a butterfly in the field, just living life with rainbows and sunshine everywhere. But they're talking about possible side effects include like stroke, heart attack, death. That's because I don't know if you guys know where those numbers come from. When they do clinical trials with medication, that if something happens to somebody while they're in that clinical trial, they have to report it. It doesn't matter if they took a Claritin in the trial walked outside and got hit by a bus, a side effect is now death. Like probably that's where those come from. So it might not necessarily mean that it could be something completely unrelated. I mean, that's a pretty extreme example, but if something happens to somebody while they're on this medication, they have to report it. Doesn't matter if it had anything at all to do with the medication. It has to be complete. It has to be talked about or listed as a side effect. Are there any questions so far? No? All right. All right. So the types of evidence. Okay. We're going to talk about these 5 different types of research. They all have their own slide. I'll go over them individually, but you have descriptive research, predictive research, efficacy research, assessment research, and qualitative research. Okay. So I want to talk real quick and then we're going to watch our YouTube video about it, but quantitative versus qualitative data. Do you guys know what that is? Are you familiar with that from past courses or yeah, heard it, kind of have an idea? Yeah. So quantitative data, you want to think of quantity, okay? Numbers. You're on a mission to prove something. That's really what your goal is. I mean, there's no absolute proofs or anything like that, but your goal is to prove that this works with this person, whatever. These are absolutes. Age, it's not up for debate. Okay, those type of things. Qualitative data, this is things like religion or location or language. It is a descriptive type. You're given more research in words than you are in numbers. Okay, so which one do you think that occupational therapy might use a little more? Why?
Okay, well, this method works.
So you think quantitative? Okay. What do you think, Grace?
Or
Okay.
no, not words. I'm trying to tell myself to put words in. It's more like factual, more
Okay.
like easier to believe, easier to get like a strong understanding. But with occupational therapy is not always same for everybody. It's barely the same for everybody.
Mhm.
So maybe call it.
Okay. Good points. So what I want you to write this word down. It's called holistic. Okay. Holistic. That is a term you're going to hear us say over and over and over and over. I don't personally care if there are numbers backing treatment interventions. I care way more about the outcomes of an individual than I do the outcomes of a group. It's just not that I don't perform my therapy. I don't practice that way. I am all about what's for the person, what's good for this person. Personally, I think in occupational therapy, we're backed a little more toward qualitative data because we do look at a holistic perspective. Now we use quantitative a lot. If there's physical ailments and stuff that we're specifically trying to treat, arthritis, broken hips, stuff like that, you're going to look more at a quality or a quantitative background, right? There's a lot of research, data, numbers, things backing that up. If somebody is having um, a panic attack or whatever, and you're with them in a treatment session, and that's one thing is to help control panic attacks or whatever. There's not a one size fits all to help somebody calm down with a panic attack, right? There are researches like such and such helps, but if you've ever dealt with somebody during that, it's not like, oh, hey, boom. All right, now on chapter 7 in my textbook, I read that if you deeply breathe, that this will stop. It's not the way it works, right? We look at it as a unique individual that we are treating. Okay, so I personally like qualitative data. I think it takes in a more holistic perspective, but you can't throw out quantitative either. Okay, because it does have its backing with OT. I'm going to wait to show you the YouTube video until the end, so that way I don't have to stop the recording.
Basically.
Basically both, but I lean toward qualitative. Yep. All right, so let's start talking about these 5 different types of research. Are there any other questions before we move on? Holistic, all-encompassing. This includes a person's values, their culture, their religion, their physicalness, everything, their mental health. It's all wrapped into one person that we treat, right? So holistic in itself is all encompassing. All right. So let's talk about descriptive research. This has also been called non-experimental research. This is where there's no manipulation of the situation, okay? Prevalence or incidence studies fall into this type of research where you're saying, you know, this group of people, there's this many instances of lung cancer or whatever it be. That's an incident study that's descriptive. We didn't change anything. We're simply researching how many people in this group has lung cancer. We didn't change anything. Epidemiology, you guys have probably heard a lot about that in the last, you know, since 2019. You know, that is something I don't even think that we really need to go into, but it is anything that's a health related state or event. It doesn't necessarily have to be a virus or anything like that, but it's the prediction of the spread or the chance of a certain health element. Prevalence. This is where a portion of is where we're looking at a portion of a population with a condition. So saying what is the prevalence of this in this community? You have incidents. This is the number of cases with a condition. So it's not necessarily a one population we're looking at. The difference is the incidence is looking at a very specific period of time. Like during 2019 to 2022, the incident rate was what of COVID? Who knows? But you know, that's the difference. So why do you think that OT cares about descriptive research? Why do you think that occupational therapy has anything to do with descriptive research?
You said like the number of cases and stuff, you're like researching stuff like for like business or something, you want to know how common it is, how much are you gonna run into it, like rheumatoid arthritis is very common, maybe, I don't know. I don't know, something.
That's
else
right,
is
you're
not
right.
very common.
Yeah, you're right. So you're absolutely right. It helps us determine the specific needs of certain populations, right? Like generally speaking, people over the age of 65, 70, now that's very generalized, but you know, they might need some generalized strengthening stuff. You know, they just have generalized weakness or something like that. It helps us determine like the needs of a general population, right? Now that again, regardless, you need to take into account the uniqueness and the individualness of the person rather than here's this diagnosis. I'm going to do the same for everybody. Okay. So what do you look at when you are appraising research? What does appraising mean, first of all? Yeah. So really like almost doing your own research about the research, right? Like how reliable is this, right? What do you guys think about surveys? Are there good things about surveys? Are there bad things about surveys? What do you think?
A good thing is that it can encompass a very large group of people. And it can kind of give you an estimate of
Very good.
how.
That's right. You get a lot of data at one time, right? It doesn't take a long time to get it. You put a date on it, you know, by next week, I need this survey back, blah, blah, blah. You get a huge amount of data all at once. What is a con to that? What do you think? Okay, that's true. That's true. Sydney, what do you think?
I think it also gives you like a way to compare to other people. So, say you're like looking at a survey and you're thinking like a treatment plan, this survey can maybe help you like diagnose like a better treatment method type thing.
Maybe so basically with surveys, there are pros. The best pro is that you get a lot of data. The cons, though, are you send it out to 100 people, but only 15 people reply. Then you're saying, well, 80% of such and such had this response, but you really didn't have that many people, right? And then if your sample size was small to begin with, if you only sent it to 15 people, I don't care if all 15 people responded to that. How accurate is that? If you're looking at, you want to survey every student in the University of Charleston and you get 30 replies back. How can you make a generalized statement about the whole student body off of 15 replies? I mean, you can't do it. Exactly. That's your response rate. Are there any questions on descriptive research? That one's pretty straightforward. Okay. So predictive research, this is also non-experimental, but it's observational. This is where at least two variables are measured to determine if they are related. Okay. So we're looking at if you live in this area, that's one variable, right? What is your likelihood of getting cancer? You're trying to predict it, like if there's bad water or something like that. So there's correlational study designs. Okay, this is the relationship between two variables, and it's collected at one point in time. Now, you guys, I'm sure, have heard in one course or another that correlation is not what? Anybody want to finish that statement? Correlation is not. Never heard it? Okay, causation. Correlation is not causation. Just because two things kind of look like they might be related does not necessarily mean that this one causes this one or vice versa, right? So it's very important to understand that just because you're looking at something and you find a correlation doesn't mean it's not a guarantee, okay? Then you have group comparison designs. These are case control designs. This is where one group where the condition is paired to a group without the condition. Okay, what would we call that? A cohort, maybe, but there's a, it starts with a C. If you have this group and this group, right? And you're comparing, this group has a diagnosis or whatever, and this one doesn't. What is this group? That's your control group, right? Because you're not looking at anything really with them. You're comparing them as your standard, your normal, right? This group is the one that you're comparing against, right? Cool. All right. So case control design is where the two groups with one condition are compared to one without. That's your control. It's kind of just breaking that down into a little bit more, right? Next one is a retrospective cohort study. This is where you follow people through time, but you do it after the fact. So you're actually looking at the past. So this, I'm going to stick with the cancer thing just because I think it helps make sense. You're looking at people that have lung cancer. You want to look at their past and follow how their lifestyle was. Oh, this one smoked, this one smoked, this one smoked, this one smoked. There's a correlation of smoking to lung cancer, right? So a prospective cohort study, this is where it follows through time, but it does look at the future, not at the past. Okay? It's trying to predict it. Okay? So when you're appraising this, I want you to remember again that correlation does not dictate causation. Okay? Second, look at the design of the study. Was it a biased form of research? Did they only look at one group of people? All of this stuff, right? So are they saying, did they pick out a group of people who worked at a chemical plant when they were doing their assessment of lung cancer to smoking and say, oh, well, they just so happened to also smoke, but they also worked at a chemical factory, blah, 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 that was, you know what I mean? Like there could be something else outlier where they trying, because a lot of people, when they go out and they set this motive for research, a lot of times they'll be biased. It's hard not to be because they have this idea, this hypothesis in their mind that this causes this. So they want to try to find a group that will make that true. You know what I mean? especially if there's a money thing involved. So it's really hard to find good quality research that doesn't have any bias in it, but we're going to talk about all the different levels and how you can determine the evidence for each one of them, okay? Any questions so far? All right, so efficacy research. What does efficacy mean? Take that root word.
I was reading this chapter and I was like, get that word.
Efficacy.
Information on the usefulness. Right there.
Right, but not, what does efficacy, just the word mean?
Oh.
What's the root word of efficacy?
How effective it is.
Efficiency. Exactly. Effective, efficiency, right. So it's the ability to provide a desired result. Okay. How efficient is this? Right. So, you already read it off there for me, but I'll do it again. It provides information about the usefulness of a particular intervention. Okay. How effective is it? Is really what it's boiling down to. So let's talk about some experimental designs here. This is where groups are manipulated. Okay, it can be more than two groups or just two, but your experimental design have to have groups. Okay, and then they're being manipulated in some way, not manipulated in like a, I'm manipulating you into doing something. It's you're changing something when I say manipulation. The first one is a randomized controlled trial. It is randomly assigned participants to at least two groups. And this is the gold standard of efficacy studies. So if I ask you on an exam somewhere, what is the gold standard of an efficacy research? You're going to tell me what? Randomized controlled trial. Very good. All right, so a non-randomized controlled trial. This is where participants of at least two groups are not random. So you're literally doing the same thing as a randomized controlled trial, but your participants are no longer random. You pick them and put them in their groups. Okay. All right, and then you have the pre-test and post-test design. This is how can I explain this a little better? You don't have a control with a pre-test and post-test design. This is where only one group is done, so it's very difficult to
You just tested.
right, but it's the same group. So is it really accurate or not? Because you don't have a control, you don't have a second group. I don't do it. Okay. And then the single subject design. This is where you literally look at one person at a time. Now, sometimes interventions start this way. Just because you start somewhere does not mean you end it there, right? Just because you have a single subject design, you have somebody, you have an idea, and I'm not necessarily talking about anything that's even invasive. I'm just talking about a new piece of adaptive equipment that you may have thought of or made at the dollar store or whatever. It could be something as simple as that. And you try it out with one patient, and then you want to try it out with another, and then you eventually work toward where you get a bigger non-randomized control item, or type of research. So what is some of the appraisal things that are important with efficacy research? You don't want to get too big into generalizing things, right? Again, you want to look at the uniqueness. You're going to appraise a lot of these researches in very similar ways. Okay. But you also want to see like, what was the sample size, all of that stuff. Any questions so far? Okay.
When you're appraising, you just want to look at for this.
A lot of them are very similar to each other. Yeah, or even the validity of it. We'll talk about what that means here in just a few minutes, but did they really generalize this to a whole lot of people when it really shouldn't have been? Those type of things. The same stuff that we talked about for the other ones. Okay, so let's take a break from talking about those types of research for a second to talk about the levels of evidence. Okay, so level 1 is your best level of evidence for anything. Level 1 is the top tier. Level 5 is the worst. Okay, so we're going to go through and I'll give you an example of what each one of those may sound like. Okay, so level 1 is it's had a systemic review, or a systematic review, a systematic examination, multiple studies on one single topic. They honed in, said this is the one area I really want to research. It has been given randomized controlled trials. It has done everything good in order to get this level of evidence. Basically, you could put this as, this works because I randomly tested it twice. Okay? That's just a very basic understanding of it, but that's level. This works because I randomly tested it twice. Level 2 evidence. This comes from a single randomized controlled trial. Someone may say that this works because I tested everyone randomly, but they only did it once. Okay, where level 1 did it more than once, at least twice. Level 3, this is a non-randomized controlled trial. This is where they may have done it multiple times, but it wasn't randomized, right? They picked who they wanted. So this one works because I tested who I wanted, okay? Which isn't always bad. I mean, do you want a randomized controlled trial if you're wanting to work with stroke patients, right? You make something for somebody who has had a stroke or whatever. You don't want somebody who has not had a stroke to test it, because what's the point, right? If you're wanting to test something out. So it's not necessarily meaning bad. It just depends on what you need. All right, so level 4, this is the pre-test, post-test. There was no control. It's really not great stuff. It's a single group. The design is very weak. This one, somebody may say, this works because I tested this one person. So-and-so had a great response. Okay, who else? Well, nobody. I haven't tested it yet. And then level 5 evidence, this is just very simply based on case studies or an expert's opinion. This works because I said so. Well, necessarily believe you. Level 5 evidence, it's all the way at the bottom. Okay. Any questions? All right. So let's talk about assessment research. Assessment research examines the reliability and validity of tests, as well as their usefulness and practice in research. So what does that mean? Reliability, this is the consistency and the stability of a test. It's how reliable is it? How has it been tested and tested and tested again? I know that if I do this, this will be my outcome. Boom, boom. It's reliable, right? This is the test and the retest reliability. Okay. Then you have the iterator disability or reliability. This is where, Professor Dindler tested this intervention, okay, and I performed it the same way it's supposed to, and then Megan will go and perform this, and I got the same result and you got the same result. Okay, a lot of times you're going to rate it on a scale of 1 to 10 with an iterator. You may say, that the pain dropped by 3, or I should be able to get the same results as you if it's that reliable. Okay, there shouldn't be you got something different and you got something different and I got something different if it's actually reliable. We should all be getting the same things or very close to the same things. Okay. All right, then you have validity. This denotes the extent to which a test measures and what is intended for it to measure. How valid is it? Okay. You have discriminant validity. This is the measure can accurately discriminate between different types of people. So it's not this works for this person, or this person in this group. Let me back it up. I feel like I'm being confusing. Discriminant validity is like, this works on, people in the United States and it works on people in China. It's not discriminant. It doesn't vary across cultures. It doesn't vary across backgrounds. This works for everyone? How valid is it across different types of people? Okay. Next is predictive validity. This is, can you really predict the outcome? Okay, this person takes a Tylenol, can we predict that their pain will go down? You know, that type of thing. And then construct validity. This is where both types of validity come together and support this. It's well accepted that this works. Go back to that Tylenol example. We know Tylenol or Advil or whatever that people want to use in general helps people's pain decrease, right? That type of thing. In general, we know that to be a pain medication. It helps with pain, right? Doesn't work for everybody. Some people Tylenol does nothing. Some people ibuprofen does nothing. Just depends. But in general, we accept it as a pain reliever, right? All right.
The construct is like,
We're both come together,
and you know it works.
more or less. We know it as a society, as a group of people, as therapists. We know if we do this, this will happen. In general, it doesn't necessarily mean it's going to. Remember, it just means there's a super, super strong correlation, but there are outliers. So appraising assessments. You might find that there are missing items in this type of research. Some items will be missing, but if somebody did a really good assessment type research, they will include that missing data. This was not tested on so-and-so. This was not tested on so-and-so, and there and so on, right? Hang on, Steve. Excuse me. Thank you. Okay, I thought I had another one coming up. All right, examining relationships. It is important that conditions are similar with assessment research. Again, you don't want, if you're testing out something for somebody that has had a stroke, you don't want somebody who's not had a stroke in your study. That does not mean that you have done bad research. It just means, why would you want that? You know, like, especially if you're trying to come up with a new piece of adaptive equipment for somebody, if they don't need it, why would you use it? You know, I want a group of multicultural people that have had strokes from different regions. That's how we differ. But we're looking at only people that have had strokes that have these circumstances. You know what I mean? It would not help at all. It would be totally outlier data. Okay, cool. All right. And then they also should use a hypothesis, right? I made this piece of additive equipment. My hypothesis is that it will help increase their independence in self-feeding. We'll just say that for an example, right? Their hypothesis should be in the realm of it, right? For something as simple like adaptive equipment, but sometimes it doesn't. All right, I want to talk a little bit more about qualitative research instead of quantitative. Quantitative is data, it's numbers, it's black and white. We know that, right? Qualitative data, qualitative research, this answers questions about meaning and experience by collecting in-depth data from the perspective of individuals with lived experience and interest. When you say qualitative research, or I say qualitative research, I want you to think unique, individuals, lived experiences. I love that statement about qualitative research because not everybody has the same lived experiences. That's what makes us unique, right? We're our own. You have no idea what other people have been through and what may sway data one way or another. You use what's called inductive reasoning. This is where we start to use the specific to the general. We use qualitative data a lot more than what people think. Excuse me. You can look at qualitative data in politics in some ways too. Like qualitatively now, West Virginia votes overwhelmingly Republican in general elections. That's a qualitative thing. Quantitative is how many people voted this way or whatever, but qualitative is really using our inductive reasoning to say specifically, or moving from specifics to general. Generalizing West Virginia, they vote overwhelmingly Republican in general elections now. Okay, so moving from a specific to an individual is using or from specific to a general is inductive reasoning. Okay. This is, I mean, you just find themes in your data for qualitative research, and that's how you come up with stuff like this. As far as data collection goes, I wanted to mention that, a lot of times with qualitative, it is collected on a few individuals. Okay. Mainly because you get so much information, you start talking about people's life experiences, you get a lot of data from one person. So a lot of times it is few individuals that you're collecting data from with qualitative research. There are some designs that we need to talk about. I'm going to attempt to pronounce this. You're going to find out throughout the semester I'm terrible at pronouncing words. I've gotten better. Phenomenology. This uses the lived experiences of individuals. That's the definition. Okay, the study of lived experiences of individuals. Grounded theory is where you collect qualitative data so that the new theory can be developed from that data. Don't overthink a lot of these words. That's a really fancy way to say the theory is grounded in data. Grounded theory. Okay. A lot of this stuff I pull right from your textbook and I look at, I'm like, didn't need to be that intense. And then narrative research, this is like a storytelling approach, and it often describes a single individual's experience during an extended period of time. Okay, so how do we appraise qualitative? Really, it's based on trustworthiness, but that's broken down up into 4 different characteristics. Okay, first one is credibility. This reflects a study's authenticity. How credible is it? Okay, I know I'm using the root words here, but it's hard to break it down any further than that. How credible is it? Transferability. Can it be applied to other situations? Can I transfer it to this one and use it across the board? Dependability. Is it consistent? Okay. And then confirmability. Has it been audited multiple times? Have other people from other disciplines looked at it, or people in your own discipline looked at it? Has it been confirmed by other people to be good research? Other people have looked at it and stuff. So, all right, we're almost done. There are 2 things or 2 slides left that we need to talk about. First one is, where do you locate professional literature? Okay, this is the new added information that we wanted to let people know about. So as far as doing research for the occupational therapy assistant program, there are these 2 websites there's a bunch out there. Wikipedia is not one. I know that everybody that likes that, and I know it's been like shunned and all this stuff too, but anyhow, specifically for occupational therapy, we have this thing called AJOT, AJOT. And I'll show you these websites here in just a little bit, but you go into ajot.com, you can find research about almost anything that includes occupational therapy, people doing research. You have academia.edu. There's a few other ones, but you have to find good research-based articles for any type of research that you do for us. Okay. In the library, there's a occupational therapy section there. I don't know where it got moved to. We'll find it one day together, maybe this week. And then they have the UC virtual library. Some other resources are the OT Practice Magazine. Now, has everybody signed up for their AOTA membership yet? It has to be done no later than Thursday. You guys have to be members, and then you have to email me like your membership page or card or certificate or whatever they send you. Email that to me. I have to have it no later than Thursday from all 3 of you. Okay.
Okay, so I signed up for the AOTA membership, but for some reason it won't let me log back in.
Have you done the forgot password thing?
Yeah, I did all that and it like just refuses to let me log back in. But it also didn't
email them.
I was gonna say, but it also didn't bill me to my knowledge.
It also didn't bill you, then you probably don't have one. So I would just start over.
All right.
So you guys have to be members with the AOTA membership by Thursday. and I have to have proof of membership. Okay. You can look at occupational therapy textbooks, other university or public libraries, whatever. You can even do a quick internet search to find other texts that you can use. There's a lot of textbooks out there about occupational therapy, a lot of books that aren't necessarily textbooks, but they're resource books. All of that stuff is fair game for research, as long as it has been, you use the principles that I taught you guys today to find good research. Okay. And then here is, I don't know why I did that, but there's the resources for today. There are, most of this information came from the AOTA website or AJOD or somewhere in that realm. Okay.